Welcome to the Casual Conversation, Wellness, Healing, and Healthcare with Daenerys, a podcast about healthcare through the lenses of mental health, microaggressions, and systemic bias. So come in, grab a cup of tea, and let's have a conversation. Welcome back to another episode of the Casual Conversation, Wellness, Healing, and Healthcare with your host, Daenerys. And I got a special guest in the building, a real good dear friend of me. His name is Joseph. And I met Joseph at one of my previous ER jobs. And Joseph has sickle cell. And so with sickle cell, it's pretty much a illness, a disease where your red blood cells, which should be round, like an actual circle, is sickle shaped. So it's kind of like a crescent moon. And with your red blood cells, they carry the oxygen to your body, to your organs, your tissues, everywhere. And as it being sickle shaped, it doesn't carry all the oxygen. So it can cause those patients to be in crises, which cause extreme pain. But before I go any further, I do want to give Joseph the opportunity to introduce himself, and then we'll just go from there. So welcome.
Welcome. My name is Mayor Joseph, and I'm originally from the island of St. Lucia. I moved over to the U.S., Atlanta specifically, in 2012. And yeah, that's just about it for me right now. But I never started experiencing the problems with sickle cell until like 2016, 2018. But yeah, that's just about it.
For sure. Okay. And so, like I said, I met Joseph through one of my previous jobs. Sickle cell primarily affects African Americans, Black people, with integration and interracial relationships. It has now kind of migrated to other demographics. However, it's only a small percentage, maybe less than 10% of the population that are non-Black people, non-African Americans. So this is just all about getting a patient's perspective of sickle cell because, as you guys know, in the medical field, Black people already have a stigma of pain and their perception of pain and just different things like that, racisms, biases, we can't feel pain and things like that. So sickle cellers definitely get that rap, and they get treated, I don't want to say the worst, but I would say the worst when it comes to that, especially like doctors not believing them being in pain as it relates to their crises, because it's like an actual real thing. And so I thought it'd be super cool to have somebody that actually goes through it, and then me from the other perspective of actually taking care of patients, including sickle cellers. So once again, I'm happy to have you on the podcast. And so let's go ahead and get into it.
Pleasure.
Absolutely. All right. So the first thing we're going to talk about is what have your hospital experiences been like as someone living with sickle cell?
Well, that depends on which hospital you go to, because let's not call no names, but a lot of hospitals in Atlanta so far, I feel like before you actually get taken serious, you actually got to get to a point where it's like near-death experience, For me, the past couple years, like the past 3 years, I've had sepsis. I had probably gotten about sepsis twice because I got a chest port. And it's like, I keep telling people, right, it's not, yes, we may visit the ER frequently. And yes, people, everybody's different, But the thing about it is that whenever you frequent that ER or whenever you see these doctors, they, rather than actually listening to what you gotta say, they always try to pinpoint it as, you just here again. You were just here yesterday, or you were just here a couple of days before or whatnot. But once ever you try to express yourself, well, me personally, I've been told so many things, such as I'm here just to get high off of pain meds and Benadryl, or I'm just here, I can't take care of myself, I need to go to a nursing home. And it's just crazy. But I always tell people, like, before I would care what people say, but now it's just like, I'll just view it as, you don't live in my shoes, so you can't tell me what I'm experiencing.
Absolutely.
And going to the CNS school, and I even opened my eyes to that. Okay, you're taught that pain is subjective to everybody, and you got to take into consideration people, how they were brought up and how they were raised and stuff. Because majority of us from the islands, we don't like taking pain medications, I would say. So we visiting the ER is not even something that we really want to do. It's just the last resort, because to be honest with you, we would just rather stay home.
Exactly.
And just drink tea and whatever, because that's, ask anybody from the islands, and that's
y'all are
what
more
they're gonna tell you.
Yeah,
It's
y'all
like,
are more of a holistic based kind of culture, like, yeah.
Growing up back home, it's like, I think the strongest thing they would give us, well, I received when I was a kid, it was like either tramadol or morphine from the ER, but I can't remember per se, because the last crisis I had was about 13 years. So coming up here is like a change in the environment, and it's like
the food, the air, everything.
It's not even that too. It's just, I'm gonna tell people, like, if you got friends with sickle cell, check up on your friends, because majority of us who are going through this, we don't have a support system. So if you that type of person, and you got a support, like, I can only speak for me. I don't have a support system. Yes, I have a dad, I have a mom, whatever, but at the end of the day, it's like, I tell people, like, being a parent and actually being involved in your child's life in your children's life is two different things. So it's like, if they're going through something, at least be there for them, or check up on what's going on, or whatever they're doing. Show some interest in it, because you never know, because everybody grieves differently. And having sickle cell and grieving is just like, sometimes it takes a toll on your body, especially when you're trying to find it on your own or do it on your own. It's really a struggle where, today you might feel alright, and then 30 minutes later, depends on how stressed you are or whatever you have going on in your life, you end up either in an emergency room or requiring to get up for pills and whatever. But back to what I was saying, like, it wasn't until I came to America I was introduced to just the pain medications, and that's the only thing that they do in the hospitals. But the disadvantage of that is just that you get called so many names, like, oh, you're drug seeking, you're this, you're that, but
they do.
Doctors don't really want to accept the truth as to, yes, we have a chronic disease, but you can't go around telling people that, oh, we're gonna be in pain every day regardless of what's going on. Right. I just had to call out the doctor on that, because he was like, oh, your labs look normal and whatever. And I had to tell him, like, bro, labs only dictate so much of sickle cell.
Absolutely.
It does not dictate the pain that you having. It does not dictate what's really going on or how you're really feeling. You just gotta trust me as a physician and say, all right, you know what, I gotta take his word for it, and let's go and see.
Yeah, but
he's gonna be honest.
But like I was just saying, like, even just that, like, they were always taught that, like, black people don't feel pain and things like that as much as white people. And I've talked about many experiences in previous episodes where, like, I would be taking care of a white patient versus a black patient with the same type of symptoms, the same complaints, you know what I'm saying? And I'm talking about simultaneously, like, let's say abdominal pain, white versus black. And the same provider will give the white person morphine and then give the black person tramadol or Toradol, you know what I'm saying? So so like, talking about exact same symptoms, exact same complaints. So
I've been through the same thing, because it's like, I went to this hospital one time, and I'm like, yo, like, my thing is with doctors is this, right? It's just the like, doctors are smart but stupid at the same time. Forgive me for saying that, but I just think that's it.
Yeah,
Because
cool.
at the end of the day, if we're taught that pain is subjective to everybody, and the thing is, when you go to doctors and you express yourself or whatever, they're quick to call you uneducated. Because I was at this hospital once and some issue happened because, priapism is a side effect of sickle cell also. So that was going on, and then they call a urologist or whatnot. And the first thing out his mouth is, oh, my friend is a sickle cell expert. And I had to stop him and question him like, bro, what does that have to do with anything? Majority of the people that y'all call sickle cell experts don't live with the disease. They study about it in school, yeah? They think that they know exactly everything, yeah? But the truth of the matter is, if you live in any, not just sickle cell, but any chronic illness that you're living in, the best way, or my thing is, the best thing to do is that everybody's supposed to have the individualized plan structured for them.
Right.
And a lot of doctors don't want to accept that. It's like, before anything, they want to do PCA.
Like a PCA pump?
Yeah.
Oh, yeah, okay.
That doesn't work for everybody.
So real quick, a PCA pump is pretty much a pump that every so often, time-wise, it delivers a specific amount of pain medicine, and the patient can press the button whenever they're in pain.
6-minute lockout or 10-minute lockout.
Oh.
But within a specific hour, you get like 2 milligrams or whatever. But my thing is, you don't get the relief that you get if you call and you ask for your medication and you get the IV push. Yes, it delivers the same medication, but it delivers it in a small amount. So rather than me getting any relief that would last for 2 to 3 hours, it's going to take me an hour to get that same medication. And then within that hour, I might be locked out about 4 or 5 times before I can get the amount of dosage that it was set to deliver.
Because you've pressed it too many times.
Yeah.
Gotcha.
So I'm saying like, okay, what sense is you just having me there in more pain? You're not doing anything for me. It's not taking away the pain. It's not, doing anything. And I think that with doctors, people, when you're in pain with sickle cell, people fail to realize the fact that when you have sickle cell and you're having a pain crisis, there's times that you're not able to walk. There's times that you're not able to even get out of bed or do anything.
You're short of breath.
And it's just like,
just
a lot of people don't understand that. They don't understand that type of pain. So they've never been in it. It's not like closing your hand in a car door or getting burned. Well, I don't know how it is to get burned, but it's just crazy. But I just feel like if people really just accept it for what it is and accept the truth that, okay, you would never know until that's you. You just got to go ahead and create an individualized plan for each and everybody with sickle cell or lupus or whatever. Because you're not in that person's shoes to feel what they're feeling. Just like at my job, they got this thing where they piggyback some IV Dilaudid or whatever. They give you the IV push first and then they piggyback the other 2 doses when you go to the emergency room.
Yeah.
That's not really helping anybody. But they're talking about, they're concerned about the euphoria that you get and whatever. And I'm like, if we've been on this medication for 5-6 years, ain't it too late to be worrying about that euphoria that we're getting? Or the side effects of that medication? Because all y'all have been doing is just throwing it at us. And the moment that we come back to you and say, okay, this dose is not working no more, we automatically become the bad guy.
Right.
So it just sucks. But I just pray that one day healthcare gets a change in America.
Absolutely.
That's just it.
Okay. I kind of want to just double back on something real quick. When you were saying that check on your sickle cell friends, or like you guys don't have a support system, I know you were saying that you could only speak for yourself, but with people that that have sickle cell, or just yourself as well, with the support system thing, do you feel like it's because of the frequent admissions? You feel like you're a burden to people? Or like, can you explain like how people, I guess like family, friends, and like they can support sickle cellers better? Because I know you guys get admitted a lot, so I can see how that can take a toll. But like, what else, do you feel like?
I'm going to speak for myself and what I've experienced. A lot of people claim that, okay, you know, they can handle anything that's thrown at them. But it's not until you're in the situation you're going to know exactly what you could handle and what, you know. Sometimes you're in a relationship with somebody, and because of you being frequently admitted, they want to take offense to that and stop talking to you, stop reaching out, whatever. Or, you know, it's just a lot of things that's going on, and they want to just be like, all right, you know what, that ain't for me, or that's too challenging, or whatever. But you might not know. Like I always tell people, like, I've lost a lot of friends just by being up here. Friends I know that when I go back home, I'm never going to see again. Family that I'm never going to see again. So I know what it's like, not just only to sickle cell, but to suicide and all this kind of stuff. And it's like,
Right.
yeah, we always got our challenges and we got life challenges. But sometimes even your parents, they're like, okay, you know, they get tired because you're always in the hospital, or you know, like, sometimes they only come to see you because they're getting something out of it, or they want some money from you, or whatever. But if you would genuinely come to see me to find out what's going on, then I'm going to feel different about it. Because if you're only coming to see me just because it benefits you, then what sense does that make? You're not, whatever that you're showing is not genuine. Because you're only coming because you're getting something out of it.
Gotcha.
And I've had a lot of friends who, yeah, man, don't even let me get started on them. But it's just crazy that, you know, you think that, okay, people gonna have your back the way that you have theirs, but it's not until you in certain situations you see exactly who's who and the limits that they're gonna go.
Gotcha.
So,
okay, let's switch gears for a little bit then. Have you ever had a positive hospital experience with sickle cell? Or like a good story to tell, or maybe a specific nurse or doctor, you know?
They've got some cool people, like, I've met along the way, like, our interaction. I never thought our interaction would have been this far, but I feel like, yes and no. Yes, in the fact that before COVID, the nurses who I came across, like, they genuinely cared. But ever since COVID, it's like the whole nursing game has changed. It's like anybody just become a nurse. And they're just in there for the money. Nobody is in there because they really want to take care of people. Yeah. Or they're really passionate about what they do. Absolutely. It's just like they just come in because they get a check. And at the end of the day, at the end of the 12 hours, they just, all right, it's time to go. Yeah, COVID really glamorized nursing for the wrong reason because they saw that money. But like I was telling y'all before in previous episodes, man, that COVID money is a once-in-a-lifetime thing. At the end of the day, nursing is real hard work. It's real shit. You got to do stuff you don't want to fucking do, smells you don't want to fucking smell. Like, deal with people you don't want to deal with. Like, it's not just about, like, the money. And honestly, like, even now I feel like nurses still ain't getting paid, but that's another conversation for another day. Even at like, all right, let's say we get shift change at 7, and if I'm admitted and I'm a patient and I call for my medication at 7, I gotta wait a whole hour just to get that for shift change. Yeah, but at the end of the day, if I call you before that time and you know it's 7 o'clock, if you're doing shift change, you could just get that medication and bring it because we're in pain. What's the sense of we having to wait 1 hour? Yeah. And it's a lot of nurses be like, oh, I'm going to go finish getting report and I'm going to bring it. And then I want to have an attitude like you're bothering them or something. And I'm like, bro, like, if you don't want to be here, like, don't come. We're not asking you to come. You chose that profession. You know exactly what you're going to deal with. So what's the sense of you coming in and then you want to have an attitude towards me and I did nothing to you? So Absolutely. If I start getting an attitude, then I'm going to become the one who's wrong. Or I'm going to become the one who's whatever. But then the other thing about it is to, man, this social media police, bro. Sometimes they come for you and they're not even educated as to what exactly the issue is. You talking about like general people or people on the social media? Like, talking about sickle cellers? Yeah, I saw this one girl who got sickle cell. Like, I used to follow her. And she said that they drew blood from her port, but then instead of wasting that blood, they put it back into her, and it caused her to go into crisis. So I was like, the 5 years that I've had my port, I've never seen somebody draw blood and then push that blood back in.
Yeah, I don't do that.
It's
You're supposed to waste it.
Man, I got people coming for me. Oh, you don't know what you're talking about. You nursing is a joke until you're gonna need one of us. And I'm like, bro, chill, because I work at the hospital too. So whatever you trying to come at me, don't try to come at me with that shit. And I try to educate myself about whatever that's going on.
Yeah.
I'm not one of these people who gonna allow you to just do something and not ask questions about it.
They don't properly clean the port. They don't properly flush it. When you're de-accessing it, trying to put the heparin in there. I'm talking about, we can talk about
You know how many people I had to get on about, this number 5. I ain't trying to make me get number 6.
Yeah.
Because of the fact that, okay, you coming in, you pushing the meds, you dropping it on the gown, whatever. Like, you're not scrubbing it, you're not doing what you're supposed to.
Yep. And real quick, like when you're accessing a port, meaning like taking the needle and putting it actually in his port that's in his chest, which gives direct access to this big vein. But like that's like a sterile, it's a sterile procedure. Like when I think about sterile, I think people in general think about like OR sterile. It's not that sterile, but we are using sterile gloves. We're using sterile procedures. So like masks, gloves, like all of it. Like you have to be like super, super clean because that's like a direct, I guess, access to like a vein. Like, like you can give somebody like some bad bacteria. Like you have to,
and it's like, bro, sometimes you be educating these nurses, bro. And it's like they more wanna catch an attitude because you telling them what to do. Like I had this one nurse. She was like, man, she literally wanted to put hands on me, and I'm like, bro, if you ever do that,
she said she was gonna slap you.
Nah. Cause like some people when you access the port, when you drawing back blood, sometimes they gotta do this and all kinds of shit. And I'm like, yo, my port don't work like that. And at the time, I wasn't feeling to do no kind of exercise just to go ahead and whatever. So I'm like, I'm gonna tell you how to do it. You just gotta flush, but don't flush everything. Flush to like half of it and then pull back. Then you're going to get proper blood flow. Let
me tell you something. When it comes to patients with chronic illnesses, I definitely ask you guys, how is the best way? What's the best way? Because nobody knows your body but you. You go through this shit like how many times a month? You know what I'm saying? Like, I'm not going to waste my time or waste my supplies or make you feel some type of way because I'm trying to be in my ego and do it my way. You know the best way, and you know what I'm saying. So I definitely listen to patients for sure.
She started going off, bro, about you disrespectful, and
That's
I'm
crazy.
Like, bro, like you know what? I'm not even gonna take you. I'm not in the mood tonight. Cause you just gonna stay here all night, and I'm not doing this.
Yeah.
Cause I just feel like we just need to get back to a time when we cared about people genuinely, and not because money is involved to just come in and be miserable about your life. Because if money is the factor that controls your life, then you're never gonna be happy, bro.
That is true.
Because at the end of the day, look at how many people who got money and they still kill themselves, and then you go back to these third world countries and they got people who barely can survive or who barely surviving, and they're happier than you. They're living more comfortable than you.
I was just having a conversation with a friend the other day. Like, going overseas, like, really makes you, or not even make you, but it changes your perspective of, like, how we're living over here. Like, those people over there don't got nearly as much money, nearly as much things, possessions, the way our housing, all that, and they are happy. They're thriving. They're bright. Even me, I feel like my mental health is just so 100% over there. It doesn't matter where I go or what country.
It just you're free. You
feel free. It's simpler living too.
Like everybody help everybody, but when you come up here, it's like if you ain't got money, then nobody wanna help. If they're not getting anything from it and whatever, so it's just crazy, bro. And it's just like this is the American dream.
So they
I'm
say.
not shading America, but don't get me wrong, it's a place with a lot of opportunities. But
absolutely,
it's just that, man, the mindset of people need to change.
Absolutely,
I feel we're living in a time where people just feel more entitled to a lot of stuff, and before anything, they say, okay, it's mental health, it's depression. I get mental health and whatnot. It just goes back to what I said. People with chronic diseases and sickle cell, like, we need a support system. Not just sickle cell, but cancer, all of this.
You need to go back to community-based things.
Yeah.
Yeah. We're very individualistic over here.
But it's like, now it's like, before you tell somebody something, oh, you controlling their life, or oh, you telling them how to live, or it just don't make no sense, bro.
Okay. So I have a question then. So from your perspective, what can medical professionals do better for patients with sickle cell?
In all honesty, I feel like before all these protocols are put in place, I feel like people with the actual disease should actually be involved in these things where they get to put us to ask questions and to find out what works and whatever, rather than just doing these protocol things for everybody, because it doesn't work.
So what he means by a protocol is basically it's a specific treatment plan or pain medication regimen that they just do automatically for all patients, is what he's saying. But
yeah, because it's like, if you go in and you have an individualized plan for everybody, and I feel like our doctors need to be more honest with themselves and more involved in it, because, man, I've had some doctors who I got to shake my head, because there's some hypocrites. 1 minute they tell you this, and the next minute, one of their colleagues call and they tell the colleagues a different story, and I'm like, bro, like, what? Just be honest, bro. You ain't gotta go say one thing about me to your people and then come back and tell me whatever. Like, it just gives me a bad taste in my mouth about you. But then from the moment that we go to a different hospital, they already say, oh, we're Dr. Shopping, we're this, we're that.
So that's what I was going to ask you, like, do y'all actually see a doctor routinely outside of your crises?
I try to keep a PCP and a hematology, but it's for, my issue is this, right? If I schedule an appointment to see you as my PCP or to see you as my hematology, I don't want to come in and see your PA or your NP all the time. At some point, I want to have an appointment with you to establish that relationship with you. So that you know what works for me, so that if I'm admitted to the hospital, you could step in and say, okay, this is what works, this is what works for him, this is what we're going to do.
Okay,
whatnot.
Yeah.
But the experiences that I've had so far, it's like, for a moment they're going to do it, but then when they consistently see you in the hospital environment, it's like, oh, they get tired, or they want to be like, oh, I'm not doing this no more, we're not doing this no more, whatever. So they tell you one thing and then they go tell their colleagues something else, or they were doing something for you that works and they stop and then they go do the general thing for everybody. And I could be like, yo, that's like, it sucks because you're not being honest.
Right.
You're just being a hypocrite at this point, because if you know what works for me, because you see me in that environment so often, it doesn't mean that I want to be here. Sometimes something is going on in my life that I'm not willing to share with you, but that don't mean you gotta switch up and be like, oh, he's always here, so do the generalized thing, whatever that works for everybody.
Right. So what you're saying is, because when you get admitted and you see a hospitalist, it could be different hospitalists. Yeah. But if you're seeing the same PCP that has privileges at hospitals, you can still see your PCP because they know you, they've worked with you, and they can better have that individualized treatment plan of what you're saying is.
I know some people do direct admissions too, because I had a doctor who did that, and for some reason she switched up. But like I said, I feel like if doctors just be honest about everything and be honest about themselves, and just the medical system on a whole just start to be honest with everybody, then they would get less people who doctor shop or who, drug sick, because they would have doctors who know exactly what works for the patient.
Right.
And not because you see that person frequently, you want to come up with a care plan for them so that when they come to the emergency room, they get nothing but pills. If I'm taking pills at home, do you think I would come to an emergency room just to get pills if it was working at home?
Right.
So all of this care plan stuff and all of this extra stuff that they're doing, I just feel it's just a waste of resources and a waste of time. Because truth of the matter is, society will always fail you. You will always get people who try to abuse the system, who will try to abuse you. But at the end of the day, it's just that you just got to know who's who and who's genuine. Because it's like, yo, if I develop a relationship with this doctor and I always go to my appointments and I do this and he knows what works best for me or she knows what works best for me, and I call and I'm like, yo, I'm not feeling well, can I just go to this hospital that I know you work at or you got affiliations with, or can you just call them and let them know that I'm coming and just admit me directly?
Yeah.
But you
to
know,
make the process easier.
at the end of the day, I know when I'm admitted directly, you're gonna put in all the orders. You know what works, so you're gonna have control over that. But then when you got like IMS and all these other doctors involved, it causes a problem more than a solution. Because let's say if I get admitted, then they consult hematology, then you got IMS, then IMS go and consult pain management, palliative care, whatever.
And then hematology probably.
So you got all these doctors involved. You see all these doctors. Hematology is the only person I feel who should be involved. Or IMS and hematology. Hematology can control the pain aspects of it, and IMS control whatever they want to control of it. But it's like there's always a discommunication somewhere. Because not every IMS doctor is willing to listen to you when you tell them that this does not work or whatever they're doing is not working. Because I had an incident which I see now that they do when it comes to doctors, especially some Asian doctors. I'm not going to call no names, but they're always like, oh, take the pills, and if it doesn't work within an hour or two, call for the IV. When I'm like, bro, why not just give me the IV and I'm going to let you know when the pills is going to work, rather than have me taking the pills, then call an hour after or 2 hours after or 30 minutes after for the IV or 45, because it's not helping. You just making me take the same medication twice. And it doesn't make any sense. It just lowers my respiratory system. That's what all these narcotics do.
Yeah.
So in the end, it's like I feel like doctors really need to be honest with themselves. And stop doing the stupidness that they're doing, causing more of a problem than actually
a solution. Okay. So, go ahead.
Yeah.
That's pretty much it. Okay. Well, I got a couple more questions for you. So we talked about the doctor's aspect of it, because that's pretty much who can, put in orders and really like do things to make you feel better, right? So we talked about what they can do better, but because I'm a nurse, I am curious to see, what do you think that us nurses can do to help make your experience or sickle cellers' experience better?
I can't talk about you because I ain't got no problem with you.
I appreciate it.
We've been real from day one. But
I appreciate it.
Man, some of this white... Come back again. My bad.
No, you good.
Some of these nurses, bro.
Be real, bro. Be real.
I feel like...
So, okay, so let's talk about it then. So do you feel like white nurses are different than black nurses? Like, how,
it's not even that. I feel like when it comes to the black people...
Black nurses or black people?
Black nurses.
Okay.
Sometimes you get white nurses who care, bro. Don't get me. They genuinely care. They'll go out of the way to be like, yo, advocate for you, and be like, no, that's wrong. We can't do that. If it's not working, why give it to him? Or if the doctor put in an order, they're going to be like, man, I'm not giving you this right now. You tell me what works for you. We're going to do this. But you got black nurses, bro, who you think would stand up for you and be like, yo, you know what? You my brother in color. But it's like, man, they more want to have an attitude. And I feel like as nurses, any healthcare worker, bro, like, I always tell people, You don't know what I'm going through when I'm in that bed. You don't know how my day was. You don't know what's going through my head. You don't know what I'm thinking about at the time. Whenever you come to work, put your problems, your personal problems on the side. Just for 12 hours or how many ever hours that you work.
Yeah.
And at the end of the day, just take it up and be like, yo, you know what? I'm going to put this aside. Let me just get through this 12 hours. I'm not going there with an attitude and whatever.
For sure.
Some of these nurses, man, they come in, they want to have an attitude. Then you're asking for your medication and it's like, oh, he's not in pain because he's on the phone, he's this. Like, your mind not telling you that, bro, I live with this disease for years. So,
once again, pain is subjective. You can't.
At the end of the day, I've trained my body to not just focus on what's going on right now so I can maneuver with my phone. I don't have to be in a fetal position crying or acting like, whatever. But I feel like that's just the thing about nurses. Like, they have to see you in that fetal position or they have to see you in that position where it's like, oh, you know what? It's really severe or whatever to actually take you serious. But that's not really it. Like, if I was born with a disease or if I was diagnosed with a disease at a young age, obviously there are things that I've learned to do to get my mind off of it.
Right.
Rather than sit down and judge people. It's like, just be honest with yourselves, man. And just be honest with people. Because the same way you got your issues, I can tell you, well, oh, you're not going for this or you're not going. If I'm a friend of yours, it's my duty to support you or to help you to go through whatever you're going through at the moment. Not criticize you or put labels on you or judge you or whatever.
For sure.
So if nurses would just more be up on that, then I feel like there would be less of an issue.
For sure.
But
yeah, and I was just gonna say, like, even me as a nurse and like going through nursing school, going through being a baby nurse, and even as an experienced nurse, like how you were saying that white nurses, there are some that actually will go above and beyond, and then there are some black people who you would think will go above and beyond because they, we can kind of connect. You know what I'm saying? Man, I've learned that not all skin folk is kin folk. Okay, so I'm happy that you pointed out
black doctors who try to throw me under the bus.
Yeah, right. So it doesn't matter what color you are, what demographic you are. Like, what he's saying is, like, everybody needs to just take them serious and go above and beyond because it doesn't really. Because
I've seen some shit in this hospital, bro, where I work at, and it's like, if the tables were turned, I would just slap the shit out of some nurses, bro.
Yeah, I feel it.
Because the same way y'all got patients in the bed, and it's like, all right, we as CNAs, we're underappreciated already. So it's like, y'all just gotta say, we gotta do the dirty jobs and whatever. And some nurses just wanna look pretty. They don't wanna do the dirty job. They just wanna come into work. Oh, go ahead and do this. Oh, go ahead and change this person.
Yeah.
Why not come and help me? We're supposed to be a team. Right. But if you're gonna have somebody there 12 hours without changing them, turning them, doing nothing. Yeah. You don't deserve to be a nurse, bro. Right. Because if that was your people, you would feel some type of way about it and go complain. So why would you want to treat somebody like that and then say, oh, you try to help out and whatever when you know you never did? Right. So, yeah. So that honesty goes. I think that honesty goes a long way. Absolutely. And the quicker that we're being honest with ourselves, not just ourselves but other people, then the quicker we come to a solution. Okay. Because it just doesn't make no sense that we're doing all of this and pointing fingers and we're not stepping up to say, all right, let me see how I can be a change in what's going on now. Advocate for people. Absolutely. With what's going on. Yeah. Okay. Well, just one last question. We talked about doctors, nurses. Now, the last thing I want to ask is, what do you want to tell the general public about sickle cell, or what do you feel like the general public needs to know about sickle cellers that they may not know, or maybe some biases, stereotypes, stuff like that? Because, the thing that I want to tell, not just the general public, but it's just my issue is with the medical professionals on the whole, is that the sooner that they realize or they accept the fact that, okay, you know, pain is subjective, and they continue to follow what they were taught in nursing school or med school, like the communication aspects of it, and to say, all right, you know, well, I'ma just go ahead and every religion is different, everybody is different. I'm not gonna go ahead and force something onto somebody that they don't feel comfortable doing.
Right.
And I'ma just accept the fact that they know their body better than me. Then, you know, it's we should probably see a change in it. Like, give people with a chronic disease a listening ear, especially people with sickle cell.
For sure.
Because we might go out with you and feel like, okay, not even sure that we're in pain, but we're just trying to enjoy the moment. But it's like the fact that everybody's like, oh, we're gonna go to the emergency room and your lab's gonna show this, and your labs, I understand that labs only show a certain aspect of it. It doesn't show the full story. So at the end of the day, the quicker that you go ahead and accept the fact that, okay, you know, that all of this is the myths and the stories and the truths, and I just deal with people for who they are.
Yeah.
And take into consideration that, okay, you know, you're always gonna get people who wanna be ungrateful sometimes, and you're gonna get people who are grateful for whatever you're doing. But it's just up to you to just differentiate and just have a good heart and say, all right, you know, I'm gonna be me genuinely, because at the end of the day, I don't have to answer to nobody but the man above, you know.
Absolutely.
So
the man above.
I ain't got nothing to prove to nobody anyway. If you're rolling with me and I'm rolling with you, I'm gonna keep it real with you, and you're gonna keep it real with me.
Absolutely.
And that's what I know. But it's not something where I'm gonna say, all right, well, he's on a phone, or he's talking to people, or he's smiling, or she's smiling. There's nothing going on. Or you know, no. and I always remember, like, people who always want to kill themselves, they wouldn't tell you they're going to kill themselves before they do it, bro. You would just... Because many a times that we put people on 10, 13s, and it's like, I feel like majority of the people who do it just to seek attention. Because, like I said, I've lost a lot of people to suicide. And I've lost a lot of people to violence and all this stuff. And I've always learned one thing, like, somebody who's suicidal, they would never tell you what they're up to. You're just going to see that they're doing it or whatnot. Sometimes somebody would say it, but you just got to watch their behavior.
Right.
And know that the happiest person in the room is not always the happiest person.
Absolutely.
So take with that and do what you want, but pay attention to your people.
And just check on your people, man, like how you said. Okay. Well, in closing, this has been a very, very good conversation, very powerful one. I do want to thank you for your vulnerability and just showing up. I know it's been a long time coming for us to film this episode, but I'm happy that we were able to make it work and get that time out. But one last closing question. Is there anything you just want to just leave? Anything you want to say? Any positive messages? Any motivational messages? Anything you know what I'm saying?
Like I said, just check on your people, bro.
Check on your people.
And I always know the happiest person in the room is not the happiest, so
absolutely.
Actually check on your people and just be a genuine person.
Okay.
You're gonna come back around.
Gotcha. Okay. Well, of course, again, I thank him for coming. Thank you so much, Joseph. It was always a good time to see you. You are so sweet, and you know we always talk outside of just sickle cell stuff about life and things like that, and I genuinely do enjoy talking to you, and I do consider you a friend, so I hope you consider me one as well.
Yeah.
And you know,
I wouldn't be here, man.
Of course. So yeah, guys, this was episode number 7 with my guy Joseph right here. Just want to remind you guys that if you don't know anybody that has sickle cell, or if you work in healthcare taking care of sickle cellers, just take what he said into consideration, like really reflect on it, process it, and be the change. Like, it starts with you, and then the way that you change and take care of sickle cellers will reflect onto other people, and then we will eventually get to a healthcare system that he's talking about that needs to change, and where we need to be for sickle cellers to be taken care of. But as always, guys, tell a friend to tell a friend, comment, subscribe, share, and we'll see you for the next one. All right, peace.